Hey, family, welcome to another episode of the Black Man's Roundtable. Today we have a very special guest on. We have Miss Ramona Roper, and today we are going to be doing a webinar today. So get ready for it. It is we doing a veterans benefit series, as some of you know that follow the roundtable, and I believe this is our first series for our veterans benefits that we're doing for 2024. So it is our May Veterans Benefits webinar, and it is going to be, it's titled the Veterans Guide to Applying for Veterans Benefits. So it's going to be a lot of information about how to apply, when should you apply, and other things you should do as far as your veterans benefits. And like I said, we have Miss Ramona Roper on today. She is our primary presenter. She is the Director of Training Division at the Georgia Department of Veterans Service. And Ramona, before we get started with the presentation, please tell our listening audience and our viewing audience a little bit about your background, which make you, in my opinion, an expert in this field.
Thank you, Rodney. It's a pleasure to be here. Good evening. My name is Ramona Roper. I was born and raised in Gainesville, Georgia. I am an Army veteran of 6 years. I served in the 82nd Airborne Division out of now Fort Liberty, formerly Fort Bragg, North Carolina.
Airborne.
Uh, who I came to Georgia Department of Veteran Service in 2007. I started as a service officer. Then shortly thereafter, was promoted to an office manager here in Athens, Georgia, which is where I reside now. In 2017, we started the training division, and I was selected to be the director. I'm very passionate about helping veterans and veterans' families obtain those well-earned and well-deserved benefits. So my team and myself, we actually train service officers here for the Georgia Department of Veterans Service.
Okay, great. Well, look, Ramona,
Yes.
with that, without further ado, let's go ahead on and bring up the slideshow.
Okay. Sounds good. All right. See if we can get
Yep.
this taken care of. All right. So hopefully you are seeing my screen. And today I'll be talking about a guide to applying for VA benefits. Again, I'm with the Georgia Department of Veterans Service. We are an accredited agency. We are state employees. We do not work for the VA. Um, let's see. What is a service-connected disability? I think, did that jump a little bit? Let's see. I'm not sure.
I
No,
think
it
you,
didn't. Yeah. Okay. All right. A lot of people come to VA or want VA benefits based on disabilities that they either obtained in service. So one of the major benefits, hang on one second, Rodney. That's okay. One of the first monetary benefits that veterans would like to obtain with the Department of Veterans Affairs is service-connected disabilities. Service-connected disability compensation. What is it? Primarily, it is a condition or injury that was incurred or caused by active duty military service. Easier said than done. You had an injury or a condition that you were seen possibly once, maybe even a few times while on active duty, that are still problematic or what the VA would say is chronic in nature now. We would want you to come to one of our offices and file for that. Presumptive conditions. It is what it is, a condition that is presumed to have been caused by military service. So right now, with Vietnam veterans exposed to Agent Orange, any condition that is under that Agent Orange registry, we would want you to come in and file. Then we've got the post 9/11 veterans. We also have the Gulf War veterans. They fall into there as well. Several different factors could cause something to be presumed. It is not necessarily a part of the law as it is written now. However, we would want you to definitely go ahead and file because the laws constantly change. Secondary conditions. In order to get a secondary, you must first have a primary condition. So, I'll use myself as an example. Shattered my knee while jumping out of airplanes. Subsequently, was medically discharged because of that one knee. Years later, developed a condition in the other knee. It was caused directly because of the way that I walk and because of multiple surgeries. So both knees are now service connected due to the injury primarily to the first knee and secondary to the second knee. Now, how to establish service connection. It's not necessarily receiving in-service treatment, but it could also, again, come secondary. You must have a diagnosis. So let's say, for instance, you went on sick call for knee sprain. You could have gone to the doctor, sick call. They said it was knee sprain. Years later, still in service, have another knee sprain. Now it's getting worse. If they diagnosed it as knee sprain, fine. If they diagnosed it for a condition, say patellofemoral syndrome, which is a bad kneecap, then we can establish it. Current medical treatment. So can't have necessarily a one-time treatment. You went to sick call for, an ingrown toenail, never had an issue. Now you've been out, 20, 30 years, develop another ingrown toenail. The VA does not look at that as a chronic condition. However, you can explain a medical nexus in there. Okay, get a medical treatment and then get that medical nexus with rationale. What does rationale mean? It means that there has to be a plausible connection to there. A lot of physicians don't like to put the rationale on nexus letters. They'll state something simply, it is my medical opinion. But you have to also establish that medical opinion as to how you arrived at that diagnosis and or the link of that. A nexus is the link of the current condition to the previous medical history of said condition. So again, you could have osteoarthritis. However, you could have had a sprained knee. It could have developed into arthritis. So that's when you need that. Buddy or lay statements. Now, a lot of veterans like to get personal statements, say from spouses and or family members. That's okay. However, VA would like those statements to come from people that had firsthand knowledge. I saw Rodney Butler fall off the back of a deuce and a half. He said his back hurt. I know he went to the medics. However, that medical information may not be in Rodney's service treatment records. But Rodney could get a statement from John Buddy that was on active duty that saw that happen and can say, I saw him fall off the back of that deuce and a half. He did complain several hours later of a back injury. That could be your link to the service in lieu of medical diagnosis and or medical statements in your service treatment records. Now, the introduction into Veterans Health Administration. You have 3 actual sides to VA. Do they necessarily talk to each other? Not all the time. So the monetary benefits come from Veterans Benefits Administration. Your health treatment comes from Veterans Health Administration. Now, Veterans Health is not automatic. You have to apply. So if you know those veterans who are reluctant to come into VA, I use my TRICARE, I go see doctor in the community. However, that does not necessarily correlate when it comes to VA. So a veteran must apply for those benefits. The application, if you're going to do a handwritten application, you can download it off of Google, and it's a VA Form 10-10EZ. I always advise veterans that are tech savvy, go to va.gov. You can look under the health care tab. You can actually do an online request or an online application, and it goes straight into the Health Eligibility Center. If you are not service connected, if you did not serve in a combat zone, then yes, there are income requirements in order to get into veterans health care. These requirements or the income thresholds are based on your county in which you live. So it's not just a flat rate. I live here in Clark County, which is considered rural. So again, the income threshold may be a lot lower than those living closer to metropolitan Atlanta. So you definitely want to look into that. There are 8 different priority groups, and VA.gov will cover those. Anyone that is service connected at least 50% or more, they are considered priority group 1. Now, does that mean that they're going to get preferential treatment from someone else that is not in priority group 1? Not necessarily. Not necessarily. However, priority group 1 does not have to make copays on any treatment, service connected or not. So you definitely want to read up at va.gov on the different priority groups. VHA or Veterans Healthcare is not insurance. It is, however, credible coverage under the Affordable Care Act. A lot of veterans who are either service connected or receiving treatment at a VA facility automatically assume I can go over here to the local emergency room and the VA will pay for it. No, no, no. If you are 100% service connected and you have a life-threatening emergency where they have to get you to the closest facility, which can be in your community, whoever your caregiver, spouse, family member, or friend, if you're being treated, it's up to them to let them know this veteran is 100%. You're going to have to contact the VA for payment. So definitely know and understand your rights to whatever group that you belong in, whichever priority group, and what your eligibility is with VA healthcare. Treatment at VHA facility does not constitute a disability from VA, the benefit side of the house. I hear it every day. Veterans constantly, well, my VA doctor said this is Agent Orange related, or this is, PACT ACT related. However, no, not necessarily. I always use this analogy. The VA can treat you from a tumor to a toenail, but benefits does not necessarily pay you for it. So you definitely want to talk to a service officer. So you definitely want to talk to a veteran service officer before randomly filing a claim for something that your VA physician has stated can be filed for, because you could set yourself up for a reduction from your current ratings. So I always advise veterans, let the VA doctors or nurses treat you, let a service officer file your claim.
You good?
The next monetary benefit is what they call non-service connected pension. And pension is a needs-based income monetary benefit for wartime veterans or veterans of wartime era that has total and permanent conditions or disabilities. Now, wartime service is the first requirement. Unfortunately, that's the way the law is written. So for our lifetime, if you will, you've got World War II veterans, you have Korea, then Vietnam. Vietnam ended May 7 of 75. The Gulf War was initiated or started August 2nd of 1990. So anybody between May 8th of 75, August 1st of 90, they are considered peacetime. A lot of veterans, well, I was in Grenada, or I was in during Grenada. Grenada is considered a conflict, not a war. So unfortunately, we as service officers, we have to be very vigilant in looking at those dates before we file for pension. And it is not a guarantee. Normally, for folks that are over 65, however, we do have younger veterans. Say, for instance, you may have an Iraqi time frame veteran, necessarily didn't go, but he served during that time frame. Maybe was in a car accident. Now they're permanently disabled due to a traumatic brain injury. They can't work. However, these injuries or conditions are totally disabling. So therefore, that veteran, because he did serve during a war period of time, would be eligible and they're less than age 65. Now, The second bullet basically says any qualifying disability that is permanent in nature. And just like I said, a car accident, that's the only one I can think of right now. But if they have a disability, so the pension looks at overall conditions that can render a person unable to work. And then, therefore, the income comes in. It is determined by the total monthly household income versus outgoing out-of-pocket medical expenses and net worth. What does that mean? They're going to look at the veteran's income to include Social Security, retirement pensions, IRAs, mutual funds, stocks, bonds, all of that. If that veteran is married, the spouse's income comes in. If they have a child or an adult child or even sometimes a minor child that works a part-time job or after-school job, that is considered income versus what is being spent out medically. So that could be their Medicare premiums, supplemental insurance, co-pays at doctors, pharmacy, mileage going to doctors or pharmacy. All of that comes in because it is not reimbursed. So the only expenses that can come out are medical expenses. If you have a veteran, say for instance, in an assisted living or nursing home, and they are paying for that care, that comes in. So those are the types of things that we as service officers will look for. And it is a dollar for dollar offset. So if veteran has a house, that does not come in. Personal property, homes, motorhomes, boats, does not come in. However, if that veteran has properties in excess of 2 acres and or say a secondary home rental property, that is used as income. So that is not excluded. And currently, the current maximum annual pension rate, or MAPR, is $155,356. The non-service connected pension is determined by the out-of-pocket medical expenses and net worth. So again, whatever is spent down. So you have to basically have a medical spend down. If the monthly income, say for instance, overall is, we'll say $5,000. The out-of-pocket medical expenses to include, like I said, insurances, co-pays, things of that nature, maybe assisted living fees. You would spend that money down to zero or anything less than the current monthly. I don't know the exact monthly rates because they differ if a veteran needs aid and attendance or housebound and or has a spouse. So we would definitely want a veteran and family to come in to see us about their eligibility for non-service connected pension. The current MAPR is $155,356. That sounds like a lot. However, if someone is in an assisted living, their annual could be $90,000. Look at how much that drops then. So we would do in practice medical spend down. But if their monthly is deemed to be zero, then they would get the maximum allowable for pension rate. Now, pension is not additional monies for monies that you already receive. You have to be at a loss in order to receive pension. And you may be eligible for both programs. Say, for instance, if you are a Vietnam veteran or a Vietnam era veteran, we'll use Vietnam era veteran. Did not go boots on the ground to Vietnam. However, you did serve during a war period of time. Now, you've had a stroke and you need additional monies to pay the assisted living or pay a caregiver. So again, you could actually be eligible for service connection. Maybe you were, this Vietnam veteran was an artilleryman and only received 10% for hearing loss, 10% for tinnitus, which is 20%, $200, possibly $300, but pension could pay up to a little over $2,000. So a veteran could be eligible for both pension and comp. However, the VA is going to pay them the higher entitlement or the higher benefit. Next slide, please.
VA burial benefits is what I got.
All right.
Okay.
Burial benefits. This is another monetary benefit for the veteran's beneficiary, not necessarily the surviving spouse. Sometimes veterans don't have spouses. So whoever takes care of the veteran's final arrangement would be the beneficiary. Now, in order to receive the burial, it is not for every veteran. Normally, a veteran would have to receive a monetary benefit in life in order to receive, or the beneficiary to receive, this benefit post once the veteran is deceased. Now, there's a caveat to that. If the veteran never received any monetary benefits from the VA, yet died of either a service-connected or a presumed service-connected condition, then that benefit is still entitled to that beneficiary. So I had a young lady that came into my office several years ago. She just wanted the burial flag. I looked at the veteran's DD-214. I looked at the veteran's death certificate. He was boots on the ground in Vietnam. He died of an Agent Orange-related presumptive condition. And I stated, ma'am, you're actually entitled to a death benefit as well as the burial. And she was very elated to hear that. However, she was quite upset with the veteran because they could have used that monies while he was living. Now, the way you're going to get the maximum $2,000 is if the veteran died of a service-connected condition or a presumed service-connected condition, but just talking about the actual service-connected condition. Now, if a veteran is 100% permanent and total, if they died prior to the 10-year mark, then it has to be directly caused by or indirectly by a service-connected condition. If a veteran had been 100% permanent and total after 10 years, then any manner of death, that surviving spouse could still receive the DIC, or the dependent indemnity compensation. If they were less than 100%, the death had to have been caused or presumed had been caused by a service-connected condition. So, case in point, veterans 20% for diabetes, died of renal failure, not service-connected for renal failure, but and the diabetes is listed on the death certificate, the beneficiary can still receive the $2,000, and the surviving spouse would be entitled to DIC, or dependent indemnity compensation. For a service-connected death, the amount currently is $2,000, and it has been $2,000 for several years, and that is non-taxable, and it is a benefit for the beneficiary of the veteran. Now, veteran status does not entitle all beneficiaries to this benefit. Again, talking to an accredited service officer, we would definitely let the family and of the veteran know their entitlement to that. So if a veteran served, hate to say it, peacetime, never had any service-connected conditions, no presumed anything, a lot of times funeral homes will send the family over to the Georgia Department of Veteran Service, and unfortunately we can tell them that unfortunately there are no burial benefits, monetary benefits for the family, and your entitlement is a flag, a marker, an interment in a veteran cemetery, whether it be state or national. So unfortunately, sometimes veterans families get the wrong information, and that's why I always advise, please come to see an accredited representative. Next slide, please.
Okay. Have the PACT Act.
Oh, yes. All right, the PACT Act 2022. This basically is the largest benefits increase both on healthcare and the benefits side in the history of the Department of Veterans Affairs. It is named after Sergeant First Class Heath Robinson, because he died of lung cancer. and it was presumed due to particulate matter while he served in Iraq and Afghanistan. And it's the promise to address comprehensive toxins act. I don't know why I put toxics, but it's Toxins Act. This was signed into law by the current seated president, President Joe Biden, on August 10th of 2022. Next slide, please.
Okay.
All right. Ronnie, is there a way you can extend that to full screen?
It's actually on full screen on my side.
Oh, is it?
Yeah.
Can't see it. Let me see.
You talking about maybe the last couple of bullets?
Well, it is like really, really small, so I can't really see. I tell you what I think I'm going to do. What slide number is that for you?
10.
Okay.
So you can bring it up and read it from your side. Yeah.
I'm so sorry. I feel like such a doofus.
No, ma'am.
Okay. I'm looking at where I messed up.
Yeah.
As far as which slides I was coming up with.
Yep, the PACT Act 2022.
Got it.
So you bring that one up on your side. It won't be seen,
Okay.
Yep, by the viewer. So you're good.
This is actually worse than what I did last Wednesday. Sorry. All right. The PACT Act 22. It expands and extends eligibility, number one, for health care. So a lot of veterans that may have served during the Saudi conflict, they can actually come into health care and not necessarily have to meet the income requirements. So, of course, this definitely covers veterans for Vietnam, Gulf War, and all post 9/11 veterans. So it added a lot more 20 plus presumptive conditions for burn pits, Agent Orange, and other toxic exposures. Now, for those Vietnam veterans in the listening audience that said, hey, I served around burn pits when I was in Vietnam. And I say to you, yes, you did. However, the law as it stands as of right now does not cover Vietnam veterans for burn pits. If you feel that confident that, that you have a condition that could most likely be caused by burn pits, you can go ahead and file those claims with the VA. Just understand that currently, as the law is as of today, it will be denied. The only way you would get that approved is it would have to go to a judge at the Board of Veterans Appeals. If there's enough studies, if there's enough information that goes with that, then the judge can overturn that and it could be granted. However, we would definitely want you to talk to an accredited service officer first. Agent Orange and other toxic exposures. So you have particulate matter, you've got burn pits. You actually have so many different MOSs or occupations, military occupational specialties that had toxic exposures. Good friend of mine was recently diagnosed with prostate cancer, but never served in Vietnam. And one of the things, he was an aircraft mechanic, and there was a chemical used to clean those materials called cadmium. So I researched cadmium, and it actually does cause prostate cancer. So this veteran is actually in the process of getting a nexus statement from the treating physician, and he has those studies that I gave, and hopefully that doctor can write a very good nexus, the rationale being those studies, and hopefully we can get him service connected for prostate cancer. So again, one of the things that I implore all veterans to do right now is VA Healthcare, along with the National Institute of Health, CDC, and several other health organizations. They are the VA is heading the research on these toxins and things. So if enough veterans are out there, I was stationed at Fort McClellan, Alabama, which was a nuclear biological chemical school, as well as military police. And one of the things that they stored there were the chemicals for Agent Orange. Rainbow herbicides, a lot of folks have never heard of that, but because Fort McClellan closing, the city of Anniston sued Monsanto Chemicals and a lot of those chemical organizations that were right there in Anniston because they were exposed to these toxins that were buried, got in the ground supply, got in the water supply, and a lot of those folks have it. So I myself, every time I go to the doctor at the VA, they ask, hey, any toxic exposure? I say yes. Because if you Google Anniston, Alabama or Fort McClellan, Alabama, it's going to tell you about that. So if you are a veteran that was exposed to any chemical or any toxins that you feel may contribute to, maybe a condition or health ailment, you have to definitely go to VA and let your physicians know and get in some of those research studies. What this does is adding more presumptive locations. The PACT Act added additional presumptive locations for Agent Orange and radiation. And again, the VA provides toxic exposure screenings to every veterans enrolled in VA Healthcare. Now, if you've never heard of it, ask your primary physician. And these screenings are every 5 years. I personally have not had one this year, but trust me, I'll be asking my physician on my next appointment. And again, this definitely helps us improve the research, the education of the staffers there, and treatment to such certain toxins. Next slide, please. Now, for Vietnam veterans that are associated under the PACT Act, the law as it is written only added 2 presumptive conditions, one being hypertension and the other being what they call monoclonal gammopathy, which is excessive proteins in the blood which can cause cancer. I get a lot of questions. Hey, how do I know if I have that? Well, if you have to ask, you probably don't. However, hypertension is one of those conditions that unfortunately a lot of veterans have. So we would definitely want to put, if you're a Vietnam veteran and you have hypertension, we definitely want you to add that on. However, one of the things I always caution veterans, when you reopen a claim, you're subject to be reopened or re-examined for every condition. So I caution those that are 100% permanent and total. A lot of veterans, well, I'm permanent total, they can't do this. Actually, they can. The VA can go ahead and re-examine you. So some veterans who are 100% that want to come in and request tinnitus, you're not going to die from tinnitus. However, you could die from a hypertensive heart, or hypertension gets too high, you could cause a stroke or something like that. Those are the conditions that we will want you to come back in and request service connection for. Next slide, please. For Agent Orange additional presumptive locations, there are so many of these, and the dates are very, very specific. So we would definitely want you, if you were on the Thai Air Force bases, previous law stated that you would have to be one of 3, you would have had to have 3 MOSs in order to get Agent Orange consideration. That changed. If a veteran served on any of these Thai Air Force bases between January of 62 through June of 76, then it is presumed, no matter your job, as long as you were stationed there, it is presumed that you were exposed to Agent Orange. Laos, Cambodia, Guam, Johnson Atoll, those were several different locations that a lot of veterans were stationed there. So that comes in. If you know a veteran that was stationed in Guam, American Samoa during those times, then we would definitely want them to be considered for Agent Orange. Next slide. Radiation exposed veterans. So if you notice, I'm not even going to try to say that E word, Anahuatic Atoll. I've tried. These were nuclear weapons that were either damaged or caught a fire, and it exposed nuclear fallout. And again, these are the veterans during the Vietnam era. So even though they didn't necessarily serve in Vietnam, notice it says Vietnam era veterans. So if they served in any of these locations, it is presumed that during those cleanups that they were exposed to radiation. So a lot of those cancers will come in. Next slide, please. Now we're going to talk about the Gulf War and the post 9/11 veterans and their presumptive conditions. A lot of veterans came back with respiratory illnesses, and if you notice, a lot of these are straight respiratory illnesses. These are now considered presumptives to particulate matter, burn pits, and other toxins that were in those regions. And so even if it is not listed here, these are not just set in stone. However, if a veteran comes down with any of these respiratory illnesses, I would implore them or you to go ahead and file. It may not be on the list as of now. However, just help the veteran who had previously applied for bronchitis and was denied. However, guess what? Bronchitis came back, and now that veteran is service connected for it. So even though it may not be on the list as it is now, laws change, research is continually going on, so that condition may come in maybe next year, 5 years, 10 years. So you definitely want to keep up with your conditions. If you notice, COPD is on there. A lot of Vietnam veterans, a lot of other veterans suffer from COPD. However, only the Gulf War and post 9/11 veterans can get it service connected as a presumptive. So you definitely want to keep up with these types of conditions. And again, when filing for anything, please see an accredited representative. Next slide, please. When it comes to particulate matter and burn pit presumptives, these specified cancers. So these are the cancers, not necessarily just the regular conditions. And if you notice, there are so many. I hope and pray that none of you are diagnosed with cancer. However, the very last one, respiratory. So just about everything under here, any type of respiratory illness or cancer of any type. It could be lung, esophageal, anything. So we definitely want you to come back and file for that. Also, in regard to death benefits, if a veteran has already passed and you know of a surviving spouse, we definitely want them to come back and file for those death benefits, because a lot of these guys, they died with certain cancers that were not a part of the law as it was. However, say for instance, if a veteran had applied for brain cancer prior to death, it was denied. Now, so on the death certificate, surviving spouse comes in, they file for the death benefit, dependent indemnity compensation. That could actually go back, the award could actually go back to the date of the veteran's filing and denial. That happened with a case that I was working on with a Vietnam veteran. He had filed for coronary artery disease, which at the time he passed was not on the Agent Orange registry. Found this surviving spouse, and we applied for the benefit. It was granted, and it went back to the date the veteran had originally applied, and she received a little over $280,000 tax free. The child that they had together actually had paid for her way through college, was still eligible to receive the Chapter 35 benefit. So again, we definitely don't want you filing this on your own. Please come to see an accredited service officer. Next slide, please. And as stated, if you were previously denied service connection for a disability that currently is now a presumptive, you can definitely come to see us, or you can file a supplemental claim, which is VA Form 20-0995, and just cite the PACT Act of 2022. That's it. You don't necessarily have to have any additional evidence. However, the VA will probably either send you to an exam or request medical evidence, but you don't have to really have anything. As long as you were diagnosed during that time frame, it was denied, all of that comes back in. Next slide, please. This is something that the VA is working on, technically kind of internal, but just a minute ago I talked about the toxic exposure and talking to your primary care. Well, TARA is, of course, an acronym for Toxic Exposure Risk Assessment or Activity. And how, I'm not going to read that whole, blurb there. However, what it is, if you feel as though you, the veteran, you feel as though you were exposed to any toxins, whether it be chemical and or work related. So those of you that were on airfields, flight lines, hulls of ships, on the back of C-130s and 141s, think about your hearing. That is actually considered a toxic exposure, whether you wore hearing protection or not. If you worked in hull of ships and I don't know, maybe that ship had asbestos on there, you could have a lung ailment. Definitely you want to make sure that you're being screened for that. This is the research that we were talking about a minute ago. We definitely want you to get screened. Track everything that you went in that you did in the military. Whether, like I said, for myself, I was at Fort McClellan. I showered. I drank water from there. I went on bivouac there. Ate dirt. So if anything comes of that Fort McClellan, just like with Camp Lejeune and several other locations, we definitely want you to keep up with that. Keep a running log of it. Check the research. Google, hey, whatever your condition is and how it may correlate to this. Gas chambers, things of that nature. So that's what TARA is. It's not necessarily something you can file for. It is your risk assessment and it's filed under healthcare. But when you file a claim, they will pull what they call a TARA on you. You won't see it. I'll see it, but you won't see it. You won't even know. But especially when it comes to hearing claims. So had a Air Force vet file for hearing loss, was actually denied hearing loss and tinnitus. However, when the VA went back and looked at it, they filed under TARA because he was a flight line. He worked on engine or jet engines. Guess what? That veteran is now service connected for hearing loss at a 0 and tinnitus at 10. The 10% now qualifies him for VA healthcare. And so there are other things. So if he was cleaning, engines with cadmium and God forbid he develops cancer, that comes into play as well. So just because it's not on the list that is current, TARA can actually get you service connection. Again, this is internally from VA. However, they will just ask your primary physician for a TARA screening. Next slide, please. And just to kind of go into a little more detail of how TARA works, it opens the door for benefit side to look at your activity while on active duty for conditions that not necessarily are presumptive but could possibly impair your health or cause illnesses. And so again, you can read over this. I'm pretty sure Rodney's going to present you with the slides, or you're welcome to stop in any of the Georgia Department of Veterans Service offices throughout the state, and we will definitely talk to you about TARA as well. All right, next slide, please. A lot of veterans have not heard of the PACT Act. What is this? This falls under healthcare. However, it is the Veterans Comprehensive Prevention, Access to Care and Treatment Act of 2020. And basically what this does is it guarantees a veteran, whether you be service connected or not, that is in a suicidal crisis, they can go to either a VA or a non-VA health facility and get free emergency care. The VA the state of Georgia, our department, Georgia Department of Veteran Service, we are serious about suicide in helping veterans that are in crisis. So if you are the veteran, your family member can get you to the family member or friend can get you to your local hospital, not necessarily a VA, and state that, hey, this person's having a mental health crisis. That hospital will stabilize them. You tell them they're a veteran. Those bills should automatically go to the VA Healthcare for payment. And they will stabilize that veteran, whether it be inpatient, until they can get them to a VA facility for further care. So again, that's the PACT Act. You don't necessarily have to be service connected. You could be a peacetime veteran, wartime veteran, but if you know a veteran that is in crisis, get them to your nearest healthcare facility for free emergency health care. Next slide, please. And to talk about the Georgia Department of Veteran Service, I've been here, like I said, since 2007, and we are accredited representatives. You probably heard me keep saying, talk to an accredited representative. Right now, there are so many veterans desperate for monetary benefits or benefits from the Department of Veterans Affairs, and they are actually paying organizations or individuals to file claims, and these people or organizations are not necessarily accredited. If you question who you're talking to, and we at the state of Georgia, we are never going to ask for payment. We are free of charge. Accredited representatives, I-19, we have to certify every year that our service officers have completed necessary training that the VA requires us to do. And as a matter of fact, in a couple of weeks, I'll be going to annual training for a week, and we have to certify, test our service officers to ensure that they are doing everything in accordance to the law, the rules and regulations that are governed by the Department of Veterans Affairs. So if you want to verify that someone is an accredited rep, you can visit va.gov/OGC/apps, or you just put in your Google search engine, OGC accreditation. It will take you to a VA website. You can check service officer and put my name in, or whoever you're talking to, Rodney Butler. And if it comes back and there's no person that exists by that name under there, they are not accredited. You can put my name in there, click VSO. It's going to come up and it's going to give you all additional 7 organizations that I am accredited with. Not only is Georgia Department of Veterans Service an accredited organization itself, we are also accredited service officers with 7 additional organizations, to include VFW, American Legion, and American Red Cross. So if I'm going to go see the VFW, you're coming to see us. If I'm going to Legion, you're coming to see us. Currently, we have over 50 offices throughout the state of Georgia. And this includes several on some of the military installations. Fort Moore, we have one there. We also have one, Fort Stewart, which is in Hinesville. And we are trying currently to get onto the Augusta Fort Eisenhower DOD facilities. So right now, we're here to serve veterans. We're here to serve veterans' families. We also have an independent appeals division. These guys work directly in the regional office, which is housed in the appeals division is housed in the regional office in Decatur. They handle solely anyone that is in an appeal. It could be a supplemental, which is when you previously denied, or a BVA, where that case has to now be heard in BVA in Washington. They actually talk to those judges. They go in there and they represent your claim or your appeal to those judges. So you as a veteran are not going in there alone. We also have an independent women veterans program division. And again, they help all veterans. We all are service officers here. And we're here ready to serve you as a veteran or the claimants that when it comes to obtaining those beneficiary benefits and or benefits for claimants and women, children, whoever. We're here to serve you. Next slide. And I believe
Ramona,
that's
this is,
it, right?
yep, this is it. And, but just for clarification,
Yes,
Fort Moore is now Fort Benning, and Fort Eisenhower. I'm sorry, Fort Moore is the old Fort Benning,
Correct.
and Fort Eisenhower is the old Fort
Is
Gordon,
Gordon.
I believe. Yeah.
Right.
So just for those old heads, that's like, hey, still trying to catch up a
I
little bit.
know.
Yep. So
I still can't
we're
say
we're
Fort
we're all still
Liberty.
trying to get, yeah, we're all still trying to get used to it. So okay, let me stop sharing. Okay. We got so many of these. And speaking of that, Ramona and I have been doing this thing now for over 2 years, I believe,
Yes.
on different organizations that I, belong to, and other things that I do. And she's just always there for us. She'll be back doing another webinar probably in November around the Veterans Day. And so, but we have a special treat because we are working very, very hard on getting here in Douglasville in person to do an actual seminar. It'll be the first time that we've done a seminar, because we've been doing all these webinars because, well, we kind of hooked up and started doing this stuff during COVID, and everybody was doing webinars and stuff. So, but we have a tentative date of the 27th of June is when we will have, Ms. Roper in person. And so therefore we will have an entire Q&A session for this seminar, and we are locking down the location because we want you to be relaxed. We want you to feel free and easy to stand up and ask Ramona any question that you may have regarding benefits. And so I have been working with Ramona, like I said, for I think over 2 years now, and I've never, look, I tell people, if Ramona can't get you the benefits, if you so deserve them, then they probably can't be gotten. And so there's not a question I've ever seen her really stumped on. If it's got to do with benefits, sometimes people will go outside the realm and start asking other stuff that may not pertain, but even then she handles it with grace. So again, we have a tentative date of the 27th of June. Stay tuned to the Black Man's Roundtable on all of our social mediums, and that digital flyer will be getting out to our audience, to our listeners, to our viewers very, very soon. As soon as we lock everything in, we're hoping to have everything locked in. If not, well, probably next week. Probably next week we should have everything locked in, and that flyer will be circulating. Ramona, is there anything? And also for this, we're not doing questions so save your questions. The ones that you really want to ask her in person. But if there are pressing questions, you can easily just you can email me. You can email the Black Man's Roundtable at gmail.com. That's the Black Man's Roundtable at gmail.com. And so with that, Ramona, do you have any other information that you want to give the listeners?
You can actually visit the Georgia Department of Veterans Service website at veterans.georgia, Georgia spelled out. You can actually visit there, and you can see a lot of the things that we do. I will be in Helen, Georgia, the whole entire organization really, in Helen, Georgia, June 3rd through the 7th, because that will be our annual training program and doing the trainings to maintain our accreditation with the VA. So I will definitely be busy, but monitoring my email. You can actually find me on there, and my email's there. So if you have any questions, you can definitely find us there. I just implore people to visit the Georgia Department of Veterans Service for all your veterans benefits needs.
And thank you. Ramona, get used to seeing Ms. Roper's face on the Black Man's Roundtable for our veterans benefits seminars and webinars. And look, like I said, if you don't believe me, ask her a question when we are together in June, and again, tentatively June 27th, and you will see what I've been seeing for 2 years. So look, we appreciate you listening. We appreciate you viewing. And until next time, we will see you in them suites and them streets. Peace. Don't forget to check us out on Spotify or wherever you get your podcasts. Do you have show ideas or want to be on the show? Shoot us an email at blackmansroundtable@gmail.com. And please follow us on Facebook.
1,